Ovace Cleanser is a skin cleansing product used to treat dandruff, seborrheic dermatitis, and certain bacterial skin infections. It contains sulfacetamide, which is a sulfonamide antibiotic that works by stopping the growth of bacteria. It is recommended to use it as directed by your doctor, usually once or twice a day. Apply a small amount to the affected area and massage gently, then rinse thoroughly. It is best to use it at the same time each day to help you remember. This medication is to be used exclusively on the skin. You should wash the affected area with this product as per your doctor's instructions, usually twice daily for 8 to 10 days. Wet the skin well and apply a generous amount to the affected areas. Gently massage the medication with your fingers into the affected area until a full lather appears. Rinse well with plain water and pat area dry. Avoid getting this medication in the eyes, nose, or mouth, or on the eyelids or lips. If you do get the medication in those areas, wash with plenty of water. The frequency of use of this medication is based on your medical condition and response to treatment. Additionally, at least once a week, wash your hair normally with regular, non-medicated, shampoo. Using this medication regularly is essential to get the most benefit from it. To help you remember, use it at the same times each day. Do not use more of this medication, use it more often, or keep using it for longer than prescribed. Your skin will not improve any faster, and your risk of side effects may be increased. If too much dryness occurs, you may need to rinse the cleanser off sooner or use the product less often. Consult your doctor or pharmacist for more details. As your condition improves, your doctor may direct you to use this product less often to keep your condition under control, once/twice weekly or every other week. Be sure to inform your doctor if your condition does not improve or if it worsens. When using Ovace Cleanser, you may experience redness, stinging, or burning of the skin. If these side effects persist or worsen, be sure to consult your doctor or pharmacist. It's important to note that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. In rare cases, serious side effects have been reported with other sulfa antibiotics taken orally. While it's unlikely with sulfa medications applied to the skin, it's important to contact your doctor immediately if you experience joint pain, a butterfly-shaped rash around the nose and cheeks, unexplained fever, mouth sores, signs of infection, unusual weakness or tiredness, unusual bleeding or bruising, dark urine, or yellowing of the eyes or skin. Using this medication for extended periods may lead to a fungal skin infection, so it's important to use it only as prescribed. If you notice new or worsening symptoms, be sure to contact your doctor. While rare, a serious allergic reaction to Ovace Cleanser can occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling of the face, tongue or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to consult your doctor or pharmacist. Before using Ovace Cleanser, make sure to inform your doctor or pharmacist about any allergies you have, especially to sulfonamides. Also, let them know if you have any broken, scraped, or injured skin in the affected area. It's important to be cautious in the sun while using this medication, as it may make you more sensitive to sunlight. Remember to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you get sunburned or notice skin blisters or redness, contact your doctor. If you have surgery scheduled, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use Ovace Cleanser if it is clearly needed, and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unclear if the drug passes into breast milk. When using Ovace Cleanser, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ovace Cleanser are products containing silver that are applied to the skin, such as silver sulfadiazine. Always consult with your healthcare provider before using Ovace Cleanser to ensure it is safe for you. If Ovace Cleanser is swallowed, it may be harmful. If someone overdoses and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, and pink or red urine. It's important to take the recommended dosage and seek medical attention if an overdose occurs. This medication should not be shared with others. Ovace Cleanser may temporarily stain clothing, but the stain can usually be washed out with normal cleaning. If you forget to take a dose of Ovace Cleanser, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When storing Ovace Cleanser, make sure to keep it at room temperature. Different brands of this medication may have different storage requirements, so it's important to refer to the package labeling or ask your pharmacist for the specific storage requirements for the brand you are using. It's important not to freeze this medication, and you may notice that it darkens slightly over time. However, this darkening does not change the effectiveness or safety of the medication. Keep all medications away from children and pets to avoid any accidental ingestion. When it comes to discarding this product, make sure to properly dispose of it when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.